Welcome, Dr. Corey. Thanks so much for being here today.
Sure.
So tell me, how long have you been in the area?
Well, I've been down here approximately 2 years, and I moved down from Philadelphia, Pennsylvania, and I joined Coastal Carolina Ear, Nose, and Throat with Dr. James DeMuzio and Dr. Kenyon.
Oh, that's great. And you have several offices, is that correct?
We do. We have an office in Whiteville, another office in Sunset Beach, and a recent open office in Leland.
And are you there every day, or?
Mainly, I'm at the Sunset Beach office. I'm in Whiteville 1 day a week, and Leland, we just started there, so I'm there 1 day a week as well.
And the other doctors, do they rotate through the
They
offices
do rotate.
too?
They're mainly out of Whiteville. However, they're at Leland and Sunset Beach as well.
I see. So there's lots of opportunity there
Lots
for
of
you to see the
opportunity.
patients. Well, that must keep you really busy. Can you tell me a little bit about your background, like where you went to school and did your training?
Sure. I grew up in Scranton, Pennsylvania, which is in the northeast portion of Pennsylvania.
Cold, huh?
Very cold, much warmer down here. And I went to the University of Scranton for undergraduate. Then I moved to Philadelphia, and I did my medical school training at Philadelphia College of Osteopathic Medicine. After that, I did a 5-year residency training program. It was a long one, at Hahnemann University. And we also trained at St. Christopher's Hospital for Children. That's where I had my pediatric training and my trauma training at Albert Einstein Medical School.
And are those in Philadelphia?
They are. Yes.
All of those are in Philadelphia. Can you tell me what it means to be an ENT doctor?
Sure.
That term's a little bit confusing.
And it can be. Most patients think that ear, nose, and throat physicians take care of tonsils and place tubes in children's ears and deal with allergies. But with our practice, we do the whole scope of ear, nose, and throat. We do head and neck surgery, head and neck cancer. We also do skin cancer resections, which is pretty prevalent down here.
All right.
We deal with obstructive sleep apnea patients and manage their symptoms and do surgery for obstructive sleep apnea. Obviously, we deal with allergies and manage sinus issues and do sinus surgery as well, and deal with pediatric patients.
Wow, that's a lot.
It is.
So what would you say is the primary focus of your practice?
Down here, it's mainly allergies and sinusitis, as well as some skin cancer excisions. I do have some pediatric training and pediatric surgeries as well to deal with.
Wonderful. Well, today our main focus is on allergies, a problem that I know many of us, including myself, have. So what's the most common allergy problem you see?
My referrals come from the primary care physicians around, and mainly it's nasal congestion, post-nasal drip, and sneezing episodes that I deal with, as well as complications from allergies such as sinusitis.
Are there particular times of the year when allergies seem to rise in this area?
Sure. This is one of the top 5 states for allergies.
Is it really? I didn't know that.
It is. It follows Pennsylvania. And mainly, the spring season is when I see the most influx of my patients. It is the tree pollen that's shed in the early spring that cause most of the symptoms. And then later spring, it's the grass that appears that causes the other symptoms.
Are there allergies or allergens in the winter?
There are. Mainly mold is more prevalent, and there are some year-round allergens as well, such as mold and dust mites that I deal with.
But outside, there's...
Outside, not too much. Usually in the wintertime or in the early wintertime, there's ragweed that appears.
Oh, yes, I'm familiar with that. Well, can you tell me how you test for allergies?
Sure. We do testing by ELISA testing. An ELISA test is a specialized test, and it stands for Enzyme-Linked Immunoabsorbent Assay. Where we
Wow, that's a mouthful.
Exactly. That's why we call it ELISA. And the patient's blood is taken. It's a sample of blood. We send it to our lab, and the lab tests it for the allergens. They mix together, and if they highlight, basically it's a specialized test to see if they highlight, if the patient's blood mixes with the allergen. If it highlights on a scale of 1 to 5, it shows the different degrees of allergies that they have. There's some older testing models out there, such as skin prick testing.
Yeah, I'm familiar with it, that on your back. You get all those.
Sure. We used to do it a few years ago where we would inject the allergens in the back, series of shots, at least 20 shots, to see if the patients would react to it. But now it's pretty simple with the ELISA testing that we use.
And so you strictly use that? You don't use the skin testing any longer?
No skin testing anymore.
I bet the kids are much happier with that.
Oh, the kids love it. They don't have to do... I had testing done when I was little. I still remember to this day having 30 shots in my back and my forearm. But for kids, it's one simple shot and they're fine.
Oh, that's good. What types of treatments do you typically recommend?
The number one treatment for allergies is avoidance. If you avoid your allergen, you're fine. If you can avoid the pollen in the air, you'll be fine. If you can avoid the dust mites, you'll be fine. But it's tough because people like to go outdoors and it's difficult to avoid dust mites. So I treat with medications, namely nasal corticosteroids such as Nasonex and Flonase. That treats the symptoms from my perspective such as nasal congestion and postnasal drip. There are other treatments out there, such as antihistamines, and many people are familiar with those, such as Allegra and Claritin. Those work mainly for the itchy ears, the itchy nose, and the sneezing episodes that patients have. So we basically use those two methods. If those fail and avoidance fails, then we do immunotherapy. And immunotherapy is a way to instill a little piece of the allergen in the patient's system slowly so that they build a tolerance to the allergen. The way we do it is by instilling drops under the tongue for the patient 3 times a day that we formulate, and they do it for a number of years, 2 to 5 years. There's also other types of immunotherapy, such as injections, that last 2 to 5 years as well.
So you don't use the injection method, you only use the...
It's a sublingual therapy. So it's a pump that the patient receives. They can do it at their convenience. They don't have to wait at the physician's office forever.
Oh, and they do this at home?
They do this at home, and it's very safe. And we basically increase the dose every 3 to 6 months depending on the patient's response. And it's great for kids.
That seems much simpler and much less painful.
Much less painful, much less time consuming.
Yeah.
So
and they can do it themselves at home.
They can do it themselves.
That's great. Are there specific things people can do at home to prevent allergies?
There is. Let's talk about seasonal allergies. So if a patient is allergic to pollen, tree pollen, what they can do is before the pollen season starts, they can remember to shut their windows so the pollen doesn't come from outdoors to indoors. Obtain a HEPA filter and air cleaner. A lot of air conditioning units have those air cleaner devices in. Also, the patients can go online and find out for their region what day the pollen count is the highest and avoid going outdoors during those days and for an extended period of time. If they do go outdoors, I recommend that the patients change their clothes because they can carry the pollen from outdoors to indoors. As far as perennial allergies, which means year-round allergies, such as dust mites, the dust mites actually live on your pillow. And they basically eat your skin and you're allergic to their byproducts. So at any rate, when I tell patients this, they want to remove the dust mites as soon as possible. The best way to do that is to wash their sheets in hot water. Patients usually wash their sheets in warm water, so I recommend hot water to kill the dust mites. Also, there's hypoallergenic pillows and pillowcases that they can use.
And they don't live on those?
They don't. They have a tendency not to. The threads are a little bit tighter woven, so the dust mites can't live in those areas as prevalent. They still do, but it's not as much. I also recommend an air filter for the bedroom. And if they have carpet in the house, it's a good idea to get it changed to hardwood flooring, so it's a nice excuse to get hardwood flooring in the house. Also, if they do like their carpet, I recommend that they use vacuum cleaners with HEPA filters and vacuum regularly.
How about plastic on pillows and things? I've heard people say they put stuff in plastic bags. Is that?
Yeah, they can. I mean, that's going to an extreme. But if you use common sense and just wash your pillows more often in hot water, patients will be fine.
So, but everybody kind of has those dust mites and those things.
They're everywhere.
Something you can't get rid of.
No, they're everywhere, unfortunately.
Oh, boy. Well, if parents notice that their children have a lot of runny noses and earaches and stuff, would it be... do you think that'd be a good idea to have testing done, have allergy testing done for that, or?
Sure. Allergies are implicated in many things, such as otitis media, which are ear infections in children, sinusitis. So what I'll do is I'll take a good history. If the child has the symptoms when they're outdoors or when they're over at a friend's house when dogs or cats are around. I typically don't test children at an early age because their immune system can change. I'll typically just take a good history, have the parents take a good history to find out what they're allergic to. The good news is the nasal steroid sprays that we do use are approved, most of them are approved for children over the age of 2 years old. So initially, if parents think they have allergies and they're very young, nasal saline is the way to go. But after that, we can use nasal corticosteroids in the nose, and it works quite effectively in children.
There's a lot of senior adults who have allergies also. Are there any special issues for older patients?
Well, one of my biggest populations for allergies is older patients, because a lot of them are from the Northeast.
Right.
Then they move down here, they haven't been exposed to the allergens in North Carolina,
Right.
and they have a hard time getting to the realization that they now have developed allergies.
Yeah, I know that firsthand.
So it's difficult down in the state. So basically what I'll do in their case, I'll narrow down to a tree pollen. It's usually pine pollen for them. So we'll do the whole pine pollen.
That's that yellow stuff?
Yeah, that's it. And a lot of it's the stuff that you can't see that you're allergic
Oh.
to. So, and you see that in the springtime. So it's good to avoid going outside, and obviously it's nice to have, it's a beautiful area around here, and patients love to garden, so they come down here
Yeah.
for the weather.
And play golf.
Exactly, and play golf. So it's difficult. You don't want them wearing a mask while they're playing golf. So then I'll use the nasal corticosteroids such as the Nasonex and the antihistamines. If that fails, then we'll do immunotherapy for them as well.
I see. You touched on pets just a little bit.
Sure.
Are there any pets that wouldn't bother allergies? Or?
There are hypoallergenic pets being breeded throughout the United States, but they're hypoallergenic. They still
And
contain...
what does that mean? What does hypoallergenic?
Hypoallergenic means they're not as allergic. They don't send off the allergen, it's the protein in their saliva. That's what you're allergic to. It's the protein in the saliva that sticks to the dander. The dander is shed, and the hair is shed. So hyperallergenic pets basically shed less. But you can get a hypoallergenic pet such as a small dog or one that doesn't shed. If you do have pets, that's the hard part. It's hard to part with your pet.
Yeah,
but
absolutely.
you can do certain things to avoid allergen exposure. Obviously, not letting them sleep with you at night. You can limit their exposure at least by 8 hours. And an air filter in the bedroom helps.
Well, that's great information, Dr. Corey.
Thank you.
For those people out there listening that would like to make an appointment with you, can you tell us how they might get into contact with you?
Sure. My phone number is 910-579-3682, and that's for the Sunset Beach office. For Whiteville, it's 910-914-0010, and that's linked to our Leland office as well.
Oh, that's great. That's easy for us. Well, Dr. Corey, thank you so much for joining us today.
You're welcome. It's my pleasure.
I'm sure many of our watchers and viewers will be interested in that.
Sure. Thank you very much.
Thank you.